Okay, we're back from the break. Thank you for tuning in tonight. As you know, I'm Dr. Michael Reiner, your host of this show. And one of the things that, before I get into this discussion about hypertension, which might bridge two shows because it's a rather in-depth topic, is that a patient had told me recently that there was rumors that I was moving out of town. Well, I'm here publicly to dispel that rumor. I am not moving out of this town. I've been here since '99, and I intend to be here for much, much longer. So if that is something that helps the patients out there, please understand you heard it from my mouth. It is being recorded, and I am not planning on moving anytime in the near future. Okay, with that being said, we want to talk about high blood pressure. High blood pressure is one of those things that everybody goes into the doctor's office and they take your vital signs and they put this cuff around your arm and they pump it up till it almost hurts, and then they usually do it by a stethoscope and they give you some reading. First things about blood pressure, it is a very dynamic process. It is never the same number. And if you go to a doctor's office and they always put down 140/80 and they put even numbers, then that's not exactly true. It depends when that person hears the pulse going through, and that's exactly what's happening. They're closing off the artery when they blow up that cuff, and the first sound that goes through is what we call the systolic, or the first sound, and that is the head of pressure being forced through that, and it's a thumping sound that you hear. And then as they open up the blood pressure cuff even more, you get well, anyway, I'm going to interrupt because we have Ray the flagman on the phone. Ray, can you hear me?
Yes, I can. It's a pleasure talking to you. Last week we had a poor connection, but I can hear you tonight.
Good. Did I answer your question about the penicillin allergy?
Absolutely.
Okay.
My question tonight, Doc, is what is your opinion of valerian root? It's an over-the-counter, and it's like it takes the tension off. Does that also lower blood pressure? If someone were to take a valerian root versus a blood pressure pill, it's over-the-counter. Would that be advantageous to lowering the blood pressure?
I'll do some research on the valerian root. I don't know a lot about it, but I'll be able to answer that for you on the next show. But I would caution people that sometimes even herbal remedies can have paradoxical effects on blood pressure. They may actually raise your blood pressure. If they claim that it lowers blood pressure, please make sure you're using it correctly and that you are checking your blood pressure 30 minutes to an hour after taking it to see if you are getting a demonstrable reduction in that blood pressure. It's also very important to understand that when you're taking blood pressure that you take it at the right time. That being said, blood pressure is supposed to go up after exercise. It's supposed to go up after activity. It's supposed to go up after you eat. It's supposed to go up after you have an argument with your wife or your spouse or things of that nature. So you want to make sure it's at the right time when you're sitting down and you have a chance to relax, and that's the constant you want to keep when you do check your blood pressure. And then we'll talk about treatment options, and you might be treating something that you might think is elevated, but the numbers and the values for treating blood pressure are changing. It's an ever dynamic process. As they do more studies, they come out with different numbers, and about every 3 years those numbers change, and so you might want to pay attention to that. It'll give you some ideas of whether or not you think you need to be treated or not. Did that answer your question?
Yes, it does. Thank you very much. You have a good evening, and it's a pleasure watching you on TV.
Thank you, Ray. Thanks for calling in. I always enjoy answering your questions.
All right,
They're very good. Thank you. Okay, so getting back to, and one of the things that I'll answer for Ray is just what the new values are, the normal values for blood pressure are, so that we can get a better idea if you fall into that group. Used to be that they always said, 120/80. Well, that number is definitely changing. The younger you are, if you're in this pre-adolescent phase, And those numbers, like if you had 120 over 80 and you were 13 to 14 years old, that could be an elevated blood pressure. So as you are young, your blood pressure should be low. As you age, blood pressure goes up to some degree, and that's a natural phenomenon, and we will discuss that. But anyway, putting that cuff on your arm, you're going to open it up and you're going to hear the first number, which is what we call the head of pressure or the systolic. And as your pulse starts to do that, if we open up that cuff even more, you'll hear the pulsing of your heart. And then when the last sound disappears, that is called the diastolic, and that is basically the resting pressure of that is the collapsibility of your blood vessels. Now, that being said, one of the things patients will always talk about is the diastolic number. And the only number that really matters in my age population, in the 35 and older, is the systolic number. That is the only number that really matters. When you're young, the diastolic does matter because it is what we call the flexibility. But most people's blood vessels when they're young, they expand. So as you take in different fluid levels, or you eat a salty meal, or you do something like that, your blood vessels are they're very loose. They're not stiff as when we get older. So therefore, it's an expandable garden hose. It's just like those garden hoses that you see on TV where they're all scrunched up, and as you start putting volume through them, they increase, and that's what young blood vessels do. So we watch diastolic in those people, but we don't watch it in the older. Okay, let's bring up the first slide because I think it brings up some interesting statistics about high blood pressure. Oh, well, let's go to the next one. There, blood pressure, chronic medical condition. Symptoms, obviously, if you think you might have blood pressure, symptoms can vary from nothing. There are a lot of people that come in and get their blood pressure checked, and we'll tell them it's elevated, and they said, well, I never had any symptoms at all. But the most common is a headache in the back of the head, and sometimes it's pulsating. Sometimes they may hear things in their ears, a buzzing sound in their ears, but it depends on how well their hearing is. Remember, blood passes through the internal carotid artery right by the middle part of the ear, so if you lose the air conduction hearing, you will hear the blood rushing through your head at night or during the day. Chest pain may be one sign, shortness of breath, and those are some mild symptoms. Pulsating, maybe even seeing your eyes pulsate, may be one of those things that you might pick up. Some statistics on blood pressure. As of year 2000, 1 billion people in the world had blood pressure. Now, obviously, that number has grown since the world's population has grown, but that's a pretty significant number. And in the U.S., 76 million U.S. adults were afflicted by high blood pressure in the year 2006. So it is a very ubiquitous disease. One interesting, 44% of African American adults affected in the world. And it does, for some reason, blood pressure does predispose certain certain groups of people, would be blacks and Filipinos and Native Americans. So if you're in that group, you have a more likelihood of having high blood pressure. Less in whites and Mexican Americans. Obviously, blood pressure does increase with age, and we will talk about that dynamic on one of the future slides coming up after the break. And there seems to be a greater incidence in the southeastern U.S. and, of course, in the lower socioeconomic areas. And as with all diseases, that tends to be the case with that, too. People just don't take care of themselves when they are poor and can't go to the doctor. At any rate, we're going to go to break, and when we come back, we'll be continuing discussion on hypertension. Thank you very much for tuning in tonight.